Good evening to all of us, and I want to say a big thank you too for joining. And for our information, let's try as much as possible to mute our microphones when we join. Secondly, this meeting is being recorded so that later it can be shared on our YouTube channel, so that in case those who couldn't join or those who want to send the link to others to listen to can also do so. So I want to welcome all of you to our second virtual scientific lecture for the year 2021. It's actually the first meeting in the month of April. And as advertised, we will start now with an opening prayer, after which I will invite Dr. Mofa, who is the president of our association, who is also going to be the chairperson for this, to give his or presenter speaks to us. Please, for those who just joined, please make sure please, so you don't have interruptions in the meeting. So kindly, let's close our eyes and pray briefly. Father, we thank you so much for an opportunity for us to come and have this discussion. As you always do for us, please be in our midst this evening also, and help us to understand this presentation. In the name of Jesus Christ, we pray. Amen.
Amen. Can the administrator mute everybody except for Eugene, please?
I think I will have to do that. So let's listen to Dr. Mofa. He introduces our speaker to us. Once that happens, we'll move on with that. Thank you very much.
Yes, thank you so much. And thank you, colleagues. It's nice always seeing some of the old guys around. Unfortunately, because of the template, we may not be able to see everybody by name to acknowledge, and so from time to time we may acknowledge those we can identify. But whether you acknowledge or not, you are still part of us, and we are in this thing together. And so thank you so much, and thank you for the opportunity to be part of this exciting and challenging times, I would say. One thing COVID has taught us, and if you remember, our last seminar was on the historical perspectives of pandemics and some of the lessons we can learn out of them. And one of the key lessons was the fact that it's important to focus on health systems. I mean, strengthening health systems before, during, and after pandemics, and so that basically influenced us, the Public Health Association, when we were thinking through what to address for 2021. Our overall theme is what we are presenting now. Basically, and it's on maintaining resilient health systems in the midst of COVID-19 pandemic and beyond. And basically with the emphasis on resilience and during and even after. So those are quite important. We are hoping that in the course of the year, we will then be breaking the health systems into its individual components and address aspects of them. I mean, talk about leadership, talk about HR, talk about this and that, and into details. And so it was important for us to get someone who will give us the overall perspective, I mean, of what some of these things will entail. We are fortunate to have an old guy to do us the honor. He's a member of the association, and he retired as the WHO representative, and know that in the WHO circles, if you are elevated to the status of the WR, we call them WR, then you are not a small boy again. I mean, in terms of capacity. He actually served in 3 of such capacities in Liberia, Botswana, and Malawi before finally retiring. But he was the former regional advisor for TB and Buruli ulcer in the African region. And I had the privilege of working with him on a number of platforms, especially in the area of Buruli ulcer in the African region, when he was working with the Afro region. But before then, he was also the program manager for tuberculosis and acute respiratory infection in the then Ministry of Health, Ghana. And at that time, that was when we were actually forming the School of Public Health, and so he became one of the founding lecturers. He is currently the founder and the director of Neo Care Medical Center at Adenta in Accra. And while doing that, he's also part-time lecturing at Accra College of Medicine as an honorary associate professor. In fact, due to his contributions to public health, and especially in the area of tuberculosis, in the year 1999, he was actually listed among the 2,000 outstanding scientists of the 20th century by the International Biographical Council, Cambridge, UK. And what more can I say? And so we are glad to have you, Dr. Eugene Nyarko, a fellow of the Ghana College of Physicians, and also, as I said, a member of the Ghana Public Health Association. And so the participants are all ears.
Thank you very much, Mr. Mufa. And thank you to all the colleagues who are around. This is a very broad topic, and to do justice to it in an hour, it's not going to be easy. So what I've tried to do to be able to save some of the time has been to look at various aspects from a general perspective. And as we go through, towards the end, I will propose some mechanisms that we can adopt to move further as we go through the rest of the year. So thanks for this opportunity. And I will start with this outline. Since we're talking about health systems, I would like us to have a quick resume about what health systems stands for. And then we will look at how COVID has impacted health systems in general. And we will also move on to look at what health systems resilience actually mean and how that can be either improved or maintained during a pandemic. And so, of course, we will look at improving the health system's resilience, some tools that are available to do that, and a few lessons that I feel going forward we can reflect on, and then a few concluding remarks. So this will be the outline I will use. Now, health systems. I will use the WHO definition of health systems, and in a few slides try to capture what that says regarding health systems. The definition, if you look into WHO documents, you will find this definition always cited. It refers to all actors, institutions, and resources that undertake health actions, where a health action is one where the primary intent is to improve health. This came out first time in the World Health Assembly publication in 2000. Now, in other words, this is referring to the agencies that plan, fund, and regulate healthcare, It's also referring to the money that finances healthcare. Those who provide preventive health services, those who provide clinical health services, and those who provide specialized inputs into healthcare, such as the education of healthcare professionals and the production of drugs and medical devices. So, from this perspective, you can clearly see that health systems are composed of interdependent parts, because each of these parts will have to work together, have to depend on each other to be able to attain the goals of the health system, which we will look at in a few seconds from now. The organizations, the money, and the people that compose health systems may be public, private for profit, or private for not for profit. So this is, by way of definition, what a health system stands for. Now, in putting this out, the WHO also cited some goals and functions of the health systems, and I will quickly run through them. There are three main goals. One is to attain good health across board. And secondly, the responsiveness to the expectations of the population. And finally, the health systems also aim to ensure fairness of financial contribution. So these are the three goals. I'm not going to elaborate much on that. And then the functions. The four original functions that were proposed, I've tried to summarize them this way. First, to provide access to a comprehensive range of health services, from preventive to rehabilitation. Secondly, to protect the sick and their families against financial costs of ill health and disability through the establishment and operation of one form or other health insurance scheme. And thirdly, improve the health of populations through appropriate governance, regulation, promotion of good health, and carrying out key public health functions, such as surveillance, etc., including food and drug regulation. So this captures the essence of the health systems by way of definition, the goals and the functions. Now, the final component of this are the so-called 6 pillars of the health systems, 6 building blocks. And these are good health services, or health services in general, that the health systems must deliver safe and effective interventions to people where and when they need them, and in an efficient manner. The second building block is the health workforce, which must be available. The appropriate number of trained staff must be available in the right fields and in the right places where they are needed, and work effectively and efficiently. The third one looks at health information system. Must be able to deliver information needed for monitoring the health status and also the health system's performance in a reliable and timely manner. The fourth one looks at medical products, vaccines, and health technologies. And health systems must ensure equitable access to safe, appropriate quality, and affordable commodities that can be used in cost-effective ways. The next one is about health financing system, which aims to raise enough money to fund agreed upon health programs and protect individuals from financial harm. The fifth one, the sixth one, is on leadership and governance, where the whole area of management, oversight, and regulation of health system is done in an open, participatory, and accountable way that ensures value for money. It is felt that by combining these 6 building blocks, paying attention to ensuring quality, safety, and universality of coverage, the three goals will likely be attained by health systems. So this captures health system in those dimensions, the 6 building blocks being key. Now, this is more like a quick refreshment of our memories regarding the health systems. In the next few slides, I would like us to look at how COVID has impacted health systems, looking at all these key building blocks. Overall, we know that COVID is like a classic global health emergency. Not global necessarily in terms of its scope, but even in its overall impact on populations, it goes far beyond the health sector, as it has caused massive disruption of almost every aspect of our human lives. And you can name it, from our health security, even the state security, economy, education, trade, social life, cultural life, political life, and you can name as many as you can. Massive disruptions have been caused in almost all these areas. And the response that nations have also mounted against this has been multidisciplinary, multi-sectoral, involving the whole of government, intergovernmental, North-South, South-South cooperation. So many of these approaches have been used because it's something that disrupted almost every aspect of our human lives. And so one could not deal with it. You couldn't hide in your own corner and say, I'm doing what I can. Even though when it came to the issue of vaccines, we started having issues with vaccine nationalism and all of that. But in principle, I think this COVID has been able to have a very far-reaching impact on our lives across the globe. And so has the response also been. Now, zeroing in on the health system, if we take the health service delivery aspect, there's been overwhelming healthcare infrastructure. COVID has overwhelmed the healthcare infrastructure in many ways, be it for routine services or for emergency services. There's been congestion almost everywhere, especially at the care facilities. And as a result, existing care facilities had to be repurposed to be able to cope with a large surge of patients who were seeking care for respiratory symptoms and also for routine healthcare needs. In many instances, countries have had to construct either new or even makeshift infrastructure to accommodate the growing numbers of patients. This is how the healthcare infrastructure has been affected. If we look further on, the disruption in service delivery has also been quite far-reaching. The overall organization of healthcare services, there has been significant disruptions across board, which in many cases have led to repurposing of existing services to respond to COVID. And as a result, some of the routine services, especially the chronic disease care services, have seen a decline. All because attention had to be directed to the impact COVID was making. To an extent where the health-seeking behavior of the public or the beneficiaries of health services have also been affected. Where people were just scared to go to health facilities because of the fear that they might catch COVID there. And so people with especially chronic diseases who needed continuity in their care were reluctant to go. And some are still reluctant to go, all because of the fear of catching COVID if I go to hospital. Business continuity planning has also been affected in many ways. If you take our diagnostic services, being a novel illness without initially any clear-cut diagnostic tool until one was developed, the diagnostic services were struggling. One, because most of the diagnostic services for the other conditions, especially the routine cases, the chronic diseases and others, which were being imported from other countries, which were also grappling with the COVID crisis, could not easily get access to these because of lockdowns, because of border closures that many nations had to take on. The same goes for the case management services. Initially, it was difficult to tell, is this an exclusively respiratory condition? Later on, when the thrombosis component was identified, there was panic. What are we dealing with? Even putting together case management protocols from the beginning wasn't that straightforward. And this highlights the disruptions that we had in the health services and still going on in some cases. Health promotion services, especially because health seeking behavior had been affected, we had to find innovative approaches, innovative ways of encouraging people to reach out to the health facilities. Because of fear, some people were not even willing to say, I have a cough and I have a respiratory illness and I need to go to a facility. Now, reaching out to them and encouraging them not only to get to the facilities, but also to maintain the preventive protocols was not easy. And this had to task the health promotion groups everywhere in reaching out to the population. So from the service delivery point of view, these are just a few highlights of how that has been affected. If we move to the human resource for health, disruptions also occurred. Staff had to be mobilized, repurposed, redeployed, and retrained to handle COVID issues, especially when it comes to key public health activities such as screening, surveillance, contact tracing, health promotion, even in the area of clinical care, especially handling the mild to moderate cases, which were in the largest numbers. It was not easy. Staff burnout was an issue. Emergency care, the ICU teams, under normal circumstances, ICU teams are not huge in number compared to the other cadres. But here, our ICUs were being overwhelmed with lots and lots of severely ill and critical patients. And when the issue of nosocomial transmission among health staff came up, that even worsened the apprehension, not only from the health staff, but also for the public, because of that spillover fear in the public about going to health facilities. Because they know that people who are working there are catching it, and some are even dying. How much more us going there? So the human resource for health was also significantly disrupted in many ways. And the effect of all this on the overall service delivery, as I mentioned earlier on, the decline in some of the, especially chronic disease, continuity care. This is human resource, but we can move on to look at health information systems. In some cases, it was a gradual, in some cases, it was a sharp shift in focus on routine data collection to COVID-19 data collection and analysis. And vulnerable health information systems in places, different places, were more or less rendered more vulnerable. And some are still more vulnerable. With respect to medicines, vaccines, health technology, because of national lockdowns and border closures, the entire supply chain system for health commodities were disrupted, be it for routine commodities or emergency health commodities. And there were also escalation of prices for most of the supplies. I think locally we can remember how a box of 50 face masks or surgical masks, which was being sold before COVID for 15 cities, suddenly went to 350 cities. I was going to buy one and I heard of the price and I was shocked. But in the midst of all this, there were some national innovations to also address existing gaps, including even coming up with some new devices. Production of face masks became a national task. If it's not coming from outside, why can't we produce it locally? Hand sanitizers before COVID, you'll find a few on the shelves in places, but now it became a very essential tool and we had to produce it locally. Our pharmaceutical companies got into it, and several automated hand washing devices were even produced. I hope in going forward and in the future, we will see some of these things in different places for making them available to the public to access. But these were national innovations that were very much needed at the time, and very well helped to address, especially the preventive protocol that we were following. We're still following because COVID is still around. So the last area I want to highlight a few aspects is the health financing. If before COVID, you had already made your health budget, that was thrown overboard. There was disruption in overall health expenditure. In some cases, funds had to be diverted from other services to address COVID. There were even national initiatives to encourage compliance with preventive protocols and to ease the economic hardships from lockdowns. For instance, in our case here, the government of Ghana had to embark on absorbing the cost of water and electricity consumption for citizens and other initiatives that came on. Creation of new national finance mechanisms to supplement health emergency response funding, because obviously whatever had been allocated for that was not enough to cope with COVID magnitude and the impact it was making. And the example we have in our case is the trust fund that the president created, which has become very handy and has helped in many ways. If we look at leadership and governance, equally so, it had its brands of a share of problems. But this is just to capture some of the key disruptions that COVID has created in almost every aspect of the health systems. Now, I will move on to look at health systems resilience and then to share a few thoughts on how we can move forward on that. I happen to find this definition that came up regarding health systems resilience just after the Ebola crisis in West Africa. And that definition says health systems resilience refers to the capacity of health actors, institutions, and populations to prepare for and effectively respond to crisis, maintain core functions when crisis hits, and informed by lessons learned during the crisis, reorganize if the conditions require it. This was captured in a publication by Crook and his team in 2017. But this definition more or less gives us an idea of what health systems resilience is all about. And in that same publication, he also highlighted a few attributes of a resilient health system as one that is integrated with existing efforts to strengthen health systems, one that is able to detect, interpret local warning signs, and quickly call for support. One that is also able to provide care for a diverse population, not just those who have been affected by health emergency, but also those who are accessing routine care. And one that is able to isolate threats and maintain core functions. Finally, one that is able to adapt health shocks. Like out of interference here. Okay, I'll move on. So, health systems resilience and these attributes are just there to help us get into a better grips with this whole thing about maintaining the resilience of the health systems during and beyond the pandemic. From the definition and the attributes, you can clearly see that health systems play a direct role in supporting a country's ability to respond quickly and efficiently to infectious disease outbreaks. And the inability of the health systems to do that will obviously amplify the human, economic, and political tolls that the crisis will generate. So, in improving health systems resilience, one will have to build on the pre-existing strengths of the systems to enhance the readiness of the system actors to respond and maintain core functions simultaneously. Because we can't focus on only one and leave the others. Now, moving forward, improving health systems resilience then, one will have to identify specific health systems capacities and capabilities required for effective outbreak preparedness and response. And having done that, to be able to define the roles and responsibilities of key stakeholders, and finally, to be able to articulate actionable steps for enhancing health systems resilience. To do this, there have been some tools in the past, very recent past, one being the WHO Joint External Evaluation, which was initially designed to respond to the international health regulations as a framework and a process meant to measure countries' capacities to implement the requirements of the international health regulations, and including the ability to prevent, detect, and respond to public health emergencies of international concern. This tool has been used by several countries, more than 100 now, to assess their capacities for infectious disease outbreaks and public health emergencies. I remember the last country I served in, Malawi, just before I left, we were in the process of preparing to undertake this exercise. So it's a tool that has been used. I'm sure we've done that in Ghana. Nevertheless, it was found out that there were still some gaps, especially the vulnerability of health facilities, the health facility actors, to respond to public health emergencies of international concern. And so a team that has been working since the Ebola crisis in West Africa in 2014, 2016, have come up with a checklist aimed at improving health system resilience. And this checklist is built around 10 thematic areas I want us to go through. In fact, their product is contained in a publication they have put out in BMJ. It's an open source publication, so we can get permission to have it and use that tool. And the idea of sharing it is to, if we've not already done so, to look at this checklist and see how we can utilize it side by side with the JEE, if we've done that already, to identify the gaps that we still have in our health systems resilience and fashion ways of addressing them. Because it's something that will have to be done as we go along. And this checklist, as I said, built around 10 thematic areas. The first thematic area looks at the core health system capacities and capabilities, those which are needed to maintain core functions during a public health emergency. For instance, access to maternal and child care. That will have to continue. And the tool avails some recommendations, some instructions to address this thematic area. Another thematic area looks at critical infrastructure and transportation. And by infrastructure, it's not just healthcare facilities, but also water and sanitation and transportation. These must be in place to ensure continuity. And so this thematic area also has a set of instructions and recommendations and suggestions on how the checklist can be used to assess this component and move forward. Financing is the next one, where adequate resources must be mobilized, both to maintain routine services and to respond to public health emergencies. The next one looks at barriers to accessing health services. The existing barriers that might prevent people from accessing care routinely and during the emergencies must be looked at. And here again, too, there are recommendations on how the assessment can be done. There are 10, so this is just the first set of 5. The fifth one here is on communication, collaboration, coordination, and partnership, referring to the relationships that exist with the different response partners before and during the emergency. The next set of 5 starts with leadership and the command structure, that the command and incident management structures and policies needed to respond to public health emergencies must also be assessed and action taken where there are gaps. The next one looks at the surge capacity. And here, policies, practices, and systems that are necessary to accommodate a surge of patients during the public health emergency must be looked at. Next is risk communication. And this again looks at policies and practices for communicating and engaging with the public about the emergency. The health workforce. The workforce with their associated capacities and capabilities, including training and support that is needed to respond to the emergency. This would also have to be looked at in detail. And finally, infection control. looking at the various processes and procedures that are needed to prevent the spread of disease, to screen and to treat patients within the care facilities. So these are the 10 thematic areas around which this checklist has been designed, and it has been done to be as comprehensive as possible. Of course, it's not the panacea for doing this exercise, but I found it to be quite comprehensive and easy to use if you go through how it's been designed. And I thought in going forward, this is something that we can use to do a form of quick assessment of where we stand as far as our health system resilience is concerned and what we need to do more in the coming days, since the pandemic is still with us and we're still going through a whole lot of things. Even with the vaccines, we will not say we have completely overcome the pandemic, and therefore this exercise needs to continue. And as we do that, we will be fine-tuning the various components from time to time. So these are the various components, and as you can see, it covers all the health system building blocks. And if you get into the publication and get the checklist itself out, it's quite a long one. It's quite comprehensive and it's quite detailed and very pragmatic in terms of how it has been constructed. So it's something that I thought I could share, and we can, moving forward, use one way or the other. Now, within each of these 10 thematic areas, the tool also highlights 2 specific actor categories who, under normal circumstances, will be responsible for each of the given thematic areas in the checklist. And these 2 are first the facility level actors, which include the individual health facilities like clinics and hospitals, health centers, and the rest, as well as the larger health system networks and healthcare organizations that play a role within the overall health system. And the second group of actors looks at the health official level actors. And by this, it's looking at, in our setting, the district, the regional, the national health officials, and the various roles they play within the health system. So there are these 2 components of the checklist. And I think it would be worth if we have the opportunity to explore it further. Right, so I will move on to the closing part of the presentation to look at some lessons for Africa. And I'm highlighting Africa in this case because of the specific lessons I think as a continent we can learn for the future. The first has to do with investment in research and development for health. This cannot be overstated. I remember sometime in 1998, 99, WHO in the Africa region, at one of its regional committee meetings and meeting of ministers of health in the continent, looked at the theme of research in health. And at the end of that, there was a resolution that was passed, making sure that all countries will apply those resolutions, looking at how countries can make specific financial commitment to research in their respective countries and identify key health priorities that need to be researched on. I think COVID has come to tell us that this is still very relevant and very important. It came with no existing solution, and countries just have to innovate. Countries and institutions with robust R&D systems and culture have been able to innovate significantly. African countries, I believe, can learn from such a lesson and enhance our capacity to innovate and share with the rest of the world in the midst of such pandemics. It shouldn't always be they sharing with us what they've done or what they've achieved. So I believe investment in research is something that we will need to continue to engage our governments in, so that we don't take this lightly and we don't dismiss this after the pandemic is over. It will benefit us in many ways. It will help to develop our scientists in ways that will enable them to produce results and tools and devices and solutions to some of our problems. So I think that is one lesson I would like to highlight. And another lesson is investment in and promotion of relevant innovations. As I mentioned earlier on, there have been several useful local innovations that have come up so far, even in some cases where our engineers had to come together to design appropriate ventilators using local materials. This must not be something that we just, oh, because of COVID, we did it and forget about it. I think this is something that we can promote. We can encourage those who got into producing some of these things and empower them to do them, even to the level of, through PPP, to be able to commercialize them. And this is something that, a lesson that COVID, I believe, is teaching us. That if we would invest in the right places, we should be able to build our own capacity to address some of these problems, and even our manufacturing capacity as far as some of these health technologies and health devices are concerned. The next lesson has to do with investment in building local or regional capacities and capabilities for development and production of certain health commodities. I believe it is not beyond African countries to mobilize themselves and invest and develop some of the health technologies and commodities for consumption, both within and share with the outside world. There is vaccine development, medicine development going on, diagnostic kits. We still rely on the East and the West to provide these things. And yet the technology can be imported in one way or the other, and our local scientists can be empowered to be able to do these things. Recently, I was reading an article where some African scientists had indicated that right from the beginning, some of them had mobilized themselves to even embark on vaccine development. They shared their thoughts and their ideas with the big African institutions, the AU and the rest. But the final decision said no. They even went as far as indicating the financial cost, comparing that to if we were to buy these from outside. Well, one would say, do we have the capacity? These guys were clear in their minds that they could embark on that through some form of partnerships. Besides, it all requires money. All these Western institutions that have been able to come up with the vaccines and the rest, their countries invested heavily. If it was a routine vaccine to be developed, it would have taken a longer time. But because of the heavy investment that the countries gave, financial investment, they were able to run the race and come up with these things. And I believe in going forward, we should be thinking along those lines. The case of Cuba, I'm not sure how far their vaccine development has reached, but that is one case in point, for instance, where because of their peculiar circumstances with all the sanctions over so many years, they have to find their own solutions. I think it's high time Africa looked inward as well and used the comparative advantage we have, as well as empower our scientists to be able to embark on some of these things and look up rather than always look down and wait for help to come from elsewhere. The last area is in ICT for health system strengthening. I believe COVID has taught us a lot of lessons about this, especially in our health information system, facilitating HIS when it comes to sharing information, giving feedback, and I mean, we can use that in so many ways. Digitizing our health information system to the extent that it can be accessed easily at the end user point and others, our civil registration data and all of that. I think this is an opportunity, but it all requires investment from not just us, the health workers, but our governments to do this. And as we engage our governments in some of these discussions, these are some of the things that we should highlight so that after COVID, we will not just say, oh, we're done with that, and then we go back to business as usual. ICT can also be exploited, especially in the area of training and the human resource for health in many ways. So these are 4 areas, 4 lessons that I think COVID is teaching us. It's not yet over, so I wouldn't say these are all the lessons. I'm sure we'll be learning more lessons as the whole pandemic continues and comes to a close, hopefully in the near future. But these are areas that I believe we can continue to reflect on and engage our non-health decision makers about not letting down our guard, but thinking deeply about these things and investing in them. Because I believe other countries who are making progress in their response have been investing in this. Let me conclude by saying, well, the COVID-19 pandemic has caused massive disruptions in the health system's performance across nations. And in doing so, it has exposed various vulnerabilities in our health systems. It has taught us that maintaining health systems resilience during public health emergencies is a must for all nations if we are to come out stronger and better at attaining the health system goals. And to ensure health systems resilience, countries must use robust tools that will enable them to assess and fine-tune their health systems preparedness and response while maintaining core functions. And I've just shared one of such tools that I've come across in my reading, and I believe there will be other tools, but we will explore further and then use some of these tools to help us assess and fine-tune our health systems resilience in this current ongoing crisis of COVID-19 pandemic. Thank you very much for your attention. I have left 3 references. In fact, the one where the checklist is cited is in this first reference. Maya and her team have put it together. They've actually tested it in several countries, one in Africa and a few in Asia. And being an open access article, I think we can have access to it. If we check the link and you put in the reference, you will definitely get the article. And then as you go through it, you will find links to the checklist, which we can print out or we can download and then look at. So these are the 3 references that I cited, and I wanted to share that as well with you. So thank you for your attention, and I will end it here. Thanks.
Thank you very much, Nyarko. Thank you very much. At this point, we will take your questions. Unless Dr. Mofa has something to say, before Dr. Mofa comes, please, you can either type your questions into the chat section or use the raise up your hand. We'll call it to us with your verbal question or contribution to the presentation that has been given to us by Dr. Eugene Nyarko. Dr. Mofa, do you have a word before we take the questions?
No, I will come in at the end as chairperson for the session and close it.
Okay. So we've had some comments in the chat. Some of them, like one from our Deputy General Secretary, Dr. Mary Ashinyo says, thank you so much, Dr. Nyarko, for sharing. And let me look at this question from Priscilla Akuma. She says, please, considering our health system in Ghana, how can we as a whole come together with other actors such as engineers, researchers, scientists, politicians, and other sectors who are not in the health system to come to develop such resilience? Can we brainstorm together so that we can get one department that can handle all these for the sake of future pandemics? Because we cannot tell what lies ahead of us. Dr. Nyarko, please, this is a question for us. The rest are Thanksgiving.
Yeah, I've seen a lot of comments, and I think this question is very relevant. One of the reasons why I made reference to this checklist is that if you explore it further, you realize that the different actors are not necessarily in the health sector. They are all over because this is a global health issue. So it looks at actors from different sectors. And I believe perhaps the structure we have in the country at the moment, and I need to be corrected if I haven't gotten it right, but the public health department could spearhead something like that, but make it multidisciplinary, multi-sectoral, and engage with people from non-health sectors, including the engineers, the scientists, researchers from different. We can even create a kind of virtual group where we can brainstorm on the checklist once we have access to it and look at the various components and see who else can contribute to the different thematic areas, who has not been thought of. And through that, we could begin to get the relevant institutions or authorities in the Ghana service involved in helping us to use some of these tools. If we've done the JE already, I think there will be, the results will be there, but this checklist can help us broaden that and reach out as far as the healthcare facility assessments, because they bear the brunt of the problem. All the patients will rush to them, but if their capacities are so weak, their capabilities are so weak, then obviously there will be transference of their problems to the higher levels. So I believe we can do this. It's just who to champion it. And that is why I've just suggested a public health department. But you know the system better than I do. I've been away for quite some time. So I think in identifying the right institution, whether it's within the Ministry of Health or it's a interministerial kind of institution, we can tag on that and then move on. I believe that the time is right to do this. So if anyone has any contribution to make as far as operationalizing something like this, I think that would be welcome.
Okay. Two more questions. Paul Boatin says, great presentation. Thank you very much for sharing with us, Dr. Nyarko. Just with a question, with your experience in other African countries comparatively, how resilient would you consider Ghana's health system in terms of resilience comparing to other African countries?
Hey, this is putting me on the spot. Well, I think I wouldn't say our somebody's system is better than ours or not, because I don't know how well they have been able to respond. But looking at how we've been able to respond so far, we've done well in many areas, but we need to do better in other areas. And I believe that Africa as a whole, we have perhaps been spared the ravages that have occurred in the Western countries and even the Asian countries for various reasons. Some we know, some we don't know. But I believe it is an opportunity for us to take quick stock and reinforce our health systems where we know we are weak, and without comparing anyone's health systems to ours. But if we use a tool like this to be able to identify what the weaknesses are, we should be able to tighten. If you ask me, I will say our health promotion response wasn't top-notch. Even though we made some efforts, it wasn't top-notch, but we can do better. Perhaps we could look at other components and see the barriers to barriers preventing people from seeking care. What can we do about that? Because it's still there. I mean, if you talk to people who are running our health institution now, the number of people who used to go there are not the same. There was a decline, a significant decline at the beginning of the pandemic, and it's still there, even though there has been improvement. So how can we address those barriers? Those, I believe, are areas that we can look at, assess better, and then have solutions that we can move on with. That is how I would like to address this question. Thanks.
And as a follow-up, someone just asked, how is resilience measured or assessed? That's co-entry, K-O-N-T-A-J. So as a follow-up to them, how is resilience measured?
Right. I gave two tools. One tool is the WHO Joint External Evaluation. It's a tool, a comprehensive tool that was designed to do exactly that, but specifically with reference to the international health regulations. However, with that tool, there are still some gaps when it comes to especially the healthcare facility level. And that is why these guys, after the experience of Ebola in West Africa, came up with this checklist, which I found to be a bit more comprehensive than the JEE when it comes to assessing the health system's resilience. So a tool like that will help us to be able to assess the resilience. And that is why I made reference to it. And I'm saying that because it's an open source, we don't need any special permission except to reference them. So we can have access to it. And perhaps what I could do would be to get the whole checklist out electronically and then share it with all of us. And we can have a look at it because it's quite detailed and it goes through every company, all those 10 thematic areas. And if we have been able to use that to do the assessment, we will be able to categorize our health system to say, hey, we are at a very good level or very poor level. That will be an exercise we will need to undertake.
Very well. Delanio says, you made a point of research support health system resilience. What can we do to get the fund holders like government interested in this topic?
I think it is a responsibility of all of us to engage the relevant people in our government, Ghana Health Service, Ministry of Health, and others to understand the implications of the COVID, not just try to cool down the fire now, but to look in the long term. And impress upon them that it is not a cheap thing. It's not a cheap exercise. If we need to know and plan and prepare well or better for the future, it's something that costs money. And yes, we can get other people. I remember the JEE, a lot of the Western donors were putting money into it. If a country expressed interest that they want to use the JEE or they want to go to the JEE exercise, a lot of the Western countries, especially the Scandinavian countries, they allocated funding to support the countries who were doing that. But again, charity begins at home. We should be able to get our governments to put our money where our mouths are. So I believe if we are able to engage with some of them, especially the highly influential ones, and make them to understand the implications of this now and tomorrow, we should be able to convince them enough to begin investing in this. Yeah.
Okay, maybe the last one before we move on. Samuel Esedi says the private, not-for-profit, and many other NGOs can play a significant role in our health system, more especially information dissemination at the community level.
Yeah.
How do we collectively harness this side of the system to work together with the state or government structures?
Yeah. Yes. I think in one of the slides I indicated that it's not something just for the public sector, but private for profit and private for non-profit. If you talk of health systems, all of them are part of the health system because they are providing service in one way or the other, and they are contributing in one way or the other. So we need to get them all involved. And this is why I found a tool like this, because when they were doing it, they went seriously intersectorial and got as many people as possible involved who gave them a lot of feedback, and they were able to use that to craft this checklist. So yes, we can't ignore the private sector completely when it comes to looking at health systems. Yeah.
So we have, I'll take Boatin when he is done, and then Kenneth Ofosubako will speak to. So Boatin, please go ahead.
Thank you very much. And mine might not be a question, but I believe that resilience in terms of our health system, Doctor was presenting more at the national level, looking at the broader. But I believe that where our implementation takes place is in the district. So there's a need to also, cascade all these, points that you have moved to the district level, so that the districts tend to have that strength of having that resiliency, in terms of organizing the people, in terms of having a very good structure, because that is where the implementation takes place. That is where the action is. And that is where, if it is strengthened, then we can sort of, curb that public health emergency that we are dealing with. With this COVID, we were fortunate that, when it came into the country, it was sort of in a pocket areas. So it was not the entire country did not see, but we do realize that areas where there are no facilities and all those things, if we have had these things, they would have been a mess, for us as a country. But then we have it in Kumasi, in Accra, where, of course, people who had traveled came in, and so we could deal with it at that level. But I believe that resiliency for a nation, we need to look at our health systems in terms of the district level, what we can do there. So that's my contribution. Thank you.
Thank you very much. What you're saying is true, but let me also say that this checklist, that one thing I found very good about it is that it cuts across the entire spectrum of levels in the country. So it has a clear component for the lower levels as you go up. And that is why, if you look at the two groups of actors, it was looking at the facility-based actors. They are the ones who are in the districts, in the clinics and the health centers, and the district hospitals. So yes, the point you made is right, but the two will be able to address that.
Thank you very much. Kenneth Ofosubako, please, you can speak.
Oh, yes.
Thank you very much, Mr. Chairman, and Dr. Nyarko, thank you very much for a well-researched paper. Thank you very much. I do recall, talking of resilience, that in 2014, when the Ebola epidemic was raging in West Africa, the Faculty of Public Health, Ghana College of Physicians and Surgeons, got the residents to assess the country's preparedness.
Mm-hmm.
And I must admit, the results were harrowing. We were definitely not prepared at all. And to address the concern of the earlier speaker, we sampled for health facilities right from the districts, to the national level. And we were not prepared at all. Our saving grace was that the virus does not cross into our territory.
Yeah.
Recommendations were made, and I'm not sure what happened to it. So my question is, and with the experience coming from WHO, studies are done, recommendations are made, and then because we are not hit into any significant measure, we just sit back and let the reports and recommendations collect dust. As a public health association, what do you think or what would be your suggestion as to how we can sort of position ourselves strategically to really push for action to support our healthcare system? Thank you.
Yeah. Thank you very much, Ken. I think this was to stimulate exactly that, because I specifically had to look for this checklist because I'd heard about it. I know one or two of the guys who were in the team working on it. So I was specifically looking for it. And the idea was, as a public association, we can see what lies ahead. We shouldn't be quiet. Let's use our network. Let's use our links to get the bigger Ministry of Health and even other ministries who could have influence to embrace this idea of, we've done this assessment before and it was terrible. We don't know whether we were adequately prepared for this pandemic, but it has not hit us the way it has hit other places. And I'm sure you remember, recently there's been the Italian government has been blamed to say that they did not do an assessment of their health system. They were supposed to have done this JEE some time ago. They didn't do it. And that is why they are blaming the Ministry of Health. The pandemic went out of control because they found out that an earlier assessment that was done showed that they were weak in almost every area, and they did not do anything about it. So they are pointing fingers at them to say, you are the fault, you are the cause. So I think we should use this opportunity. To me, COVID has given us a lot of opportunities. It's a threat, but also a lot of opportunities. And I believe if we can come together and find a common voice and begin to engage our colleagues who have to make the decisions, we should be able to get this exercise underway, because this is not the only pandemic we may experience. Perhaps there might be other pandemics to come in our lifetime. How well are we going to be prepared tomorrow? Should we have one that will directly attack us? Will we be adequately prepared to address it? So let's use our association as some form of pressure group to get the powers that be to make the decisions. Even with this pandemic, we made certain recommendations that eventually were actioned by government. I understand the infectious disease hospital that was built was one of our suggestions. So it means that we will be listened to. So let's not keep this to ourselves and say we've had a nice scientific session, but let's see this as an emergency that we have to champion. And some of us are no longer in service, but we can be there to link up with those of you who will be engaging the higher powers to make sure our voice is clear, and also identify those partners who would want to partner with us if we are going to go this route. I will personally would like to contact Diane Mayer, who is the lead author in this publication that came up with this checklist, to get some insights from her as to how we can operationalize this. And that would be one contribution that I can make, because he's clearly stated that if we want to, anybody wants to use that, they will be willing to share some more ideas with them. And I believe we can brainstorm around other ways we can engage our powers that be to take this up seriously. Because yes, we have been saddled with good documentation, and then it gathers dust. Good documentation, it gathers that. It's been going on for a long time. Let's make this one of our biggest contribution of our generation to public health development in the country. And those of us who are currently not in active service, we can take part in it. Thank you.
Thank you very much. For the first time, we are going to take these 4 comments. We'll take 2 at a time, then you respond, then we'll take the last 2 so we can close a bit early. So we'll take Dr. Agongo will speak, and Mercy Ahun will also speak after Dr. Agongo speaks.
Okay, thank you, Dr. Eugene. I think you've done the topic very, very well.
Thank you.
It is a good stage for us to move forward with the other elements.
Yes.
But I want to state that actually the GEE was conducted in a number of countries.
Yeah.
And Ghana, about I think 37 countries, and the results were very poor. Ghana had the GEE in 2017. And although comparatively were much better than most of the other countries, South Africa was leading, of course. But one thing that was very strong on our point was EPI component and our first program. In other areas, we did not do all that well, but most of it was where at least the systems were in being built. That's a good start.
Okay.
But what is also very important is the role of primary health care in making health system resilient.
Yes.
I think the public health, the primary health care initiative to realize that they have been pursuing this agenda for quite some time now, particularly with the new Astana Declaration. 3 components have been identified as very important for actually making health system resilient. The first component being integrated primary care and essential public health functions that are very key. And that should be built into the system. Secondly, the issue of multi-sectorial policies and actions. Thinking of health in all policies as an important element. And the last element being the component of engagement and empowerment of communities. And these areas, there's a special publication of WHO Bulletin, where they have actually also tried to outline some of the findings as to what has been exposed with this COVID. And the critical areas are the fact that those countries that try to look at these 3 components and work in tandem, the results are revealing that the response was better. And it is true that WHO also came out with the levers for operationalizing PHC. And it's 4 strategic levers and 10 operational levers. And the strategic levers are so fundamental. 1, political commitment and leadership. 2, the health financing. You know, the community engagement and other stakeholders. These are very critical. And if you look at the Ghanaian situation, I think what one has been very commendable is political commitment and leadership at all levels as demonstrated. Because when it started, we realized the national level, this was quite encouraging. To go to the regions, people took up the issue as their own, and to the district level. And that was how probably you realize that the spread of the disease, the whole country did not just go like wildfire, but because there were this type of leadership movement. But the basic challenge was really financing and the other issues. So I think maybe we should revisit that. Actually, one of the things that WHO is trying to look at is those countries that conducted the primary healthcare performance and profile studies, the 20 low and middle income countries, which Ghana was part. They are requesting that we should look at our COVID response with the eye of primary healthcare and see which areas we did well, which areas we didn't do well, and what can we do next. And I'm leading that case area. I would be most grateful if any of you would want to contribute, because apart from the literature review I'm conducting now, I'm supposed to interview about 10 to 20 field experts who are knowledgeable and interested in that field, so that we gather their information and synthesize into a report. So this is just an appeal to those currently on the platform, those who think they can contribute and they think they have ideas that can improve our response, not only COVID now, but such similar problems in the future.
Yeah.
Thank you.
Yeah. Good. Thank you. Thank you, Doc.
Madam Mercy, do you still want to speak? Your hand is down now.
Yeah, thank you very much. I think a lot of the things that I wanted to talk about, Dr. Agongo had mentioned. And thank you, Dr. Agongo, for that input. But one other thing that I wanted to talk about is how we ensure that such scientific sessions of the GPHA, we have our policymakers participate.
Yeah.
Because I think at the end of the day is very important that this is not just something that is presented to them on paper, but if they participate actively, they are more likely to take it forward. And some of the things that Dr. Agongo talked about, I also wanted to talk about how you present information in bites, because if you present things to politicians and it's a long list, it's more difficult. But if I like the way that he presented the 3 areas that they're working on, because I think that then becomes a biteable size that politicians can be able to work on. So I think at the end of the day, we should look at how do we make this practical and realistic and present it in such a way that our politicians will be able to act on it. Because there are so many priorities, but we have to use this COVID season to say that these are the 3 top things that you need to do over this time period and face it out so that they are not faced with a deluge of things to attack. So thank you very much, Dr. Nyarko.
Thank you. Thank you, Mercy. Yeah, action. That is all I can say, action.
Okay. Time is fast spent, it's 8:30. We'll take Dr. Amofa's closing comment and then we'll round up, please.
Right.
Thank you, Eugene. Once again, I knew you'll be able to do justice to the topic, and to thank you all for being part of this. It's very interesting when you look at a very broad topic like health systems, and the conclusion is that nothing has been done. I mean, if you cast your mind back, I tell you quite a lot has been done. If you look at COVID, the assessment that was recently done actually put Ghana second after South Korea. I mean, in terms of systems to address that. And so when they really listed those, unfortunately I don't have the link here, but it was widely discussed. But it's just to tell you that health systems is a very difficult area. And because, well, like Mercy said, because it's not a one area topic, no, you may do well today in an aspect. How do you sustain it over the years? I mean, look at what is trending about the Kokolebu issue, where somebody, whether it's true or not, is another matter. But I think something like that happened. I mean, a patient goes there, somebody, and I'm sure that the health may not even be aware. Somebody at the OPD demands that he needs a COVID testing before he is admitted, and before he goes up and down and up and down, no, the patient pops off. That is not part of policy. It's pure, I mean, negligence of an individual person. Because the policy is clear, whether COVID or not, emergency is emergency. You manage that person before anything I mean, you cannot do otherwise. And so it's quite a very difficult area, and your presentation even highlights the complexity of the topic, and I'm sure this is just even the tip of the iceberg. But quite a lot usually is done. The only problem is that sustaining it has been the challenge. I've seen some of the PPME, Ministry of Health persons on the platform. We actually engage them. We invite everybody, including the very top. I mean, presidential advisors and all those, and because we are together at another forum, and so most of them are aware of that, and so that is actually happening. I just want to conclude by sharing the JEE equivalent that was done in 2015 during the Ebola thing, and that was the assessment to look at the preparedness of Ghana, basically in January 2015, and the scoring as at that time, and what actually informed some of the things that are happening now, as if it has been put aside. And tracking back, you can see that quite a lot were actually learned from it, and that influenced the policy. The general combined preparedness as at that time was assessed at 32%, and I'm only looking once again only at the 0 ones and the minor ones. The coordination was basically 0. We didn't have a UOC, emergency committee where to address any preparedness. In fact, then the NTCC was not part of the National Technical Coordinating Committee. Somebody was talking about how do you get other people who are not members of the Ministry of Health Ghana Service to be part of the larger system. That all those things were not in place. We were assessed as 0. In terms of public awareness and other things, that had always been quite poor. But if we look at safe and dignified barriers, as at that time, it was 0. Contact tracing was just about 50%, and that was because of the CSM tracing and a few other things. If we look at the capacities at points of entry, it was actually assessed as 0. In fact, I took part in the in some of the assessment and other things, and all these temperature what should I say, tools, walk through the temperature monitoring and other things were actually brought into the picture to as part of the design of a national strategic plan for public health emergencies of importance. Those at that time were 0. But because of some of these, I mean, a national strategic plan was developed. The coordinating mechanism was established, and that really has influenced the management of COVID as we speak. In fact, every 2 weeks, the NTCC is meeting, chaired by the Minister of Health himself and all the big people. And so quite a few things are happening in terms of training for contact tracing. The TTT aspects were all informed by the fact that, I mean, we were not prepared to deal with Ebola, as we said. But going forward, quite a few other things happened with the influenza experience. I mean, some of those things also helped us. Logistics, I mean, PPEs and other things was actually 0. I mean, we were assessed as 0, but that improved a lot. You talked about the sanitizers, the gloves, and other things. But those things were all part of the larger attempt to improve upon the system. But in the developing country, just as you said, I mean, when even the almighty Americans and the Europes and other places were, I mean, on their knees, you can imagine what actually happened. A lot still needs to be done. I think the community engagement part, as you correctly said, I mean, has been very poor still, because changing people's behavior is always a challenge. And the part communities themselves have to play, I mean, have not been really emphasized too much. People depend too much on government, what government and the ministries will do, rather than what they can also do. When you talk about the empowerment aspect. And so those are some of the larger challenges. As for engaging the top people, I tell you, it's almost on the 24-hour engagement. Almost every single thing that is happening, so some people are behind, pushing left, right, and center. If there's a need to come out with a communique, normally people will do that. But on a 24-hour basis, I mean, do this, do not do this, do that. I mean, expand on this, improve upon that. At the top, highest this thing, including the Minister for Health, the Deputy, the Director General, the Director of Public Health, and over and above. They recognize the value of the association and the inputs some of us are making. But you cannot do all. Just as you said. And I want to put the challenge to all of us. Public health is not the responsibility of individuals.
No.
In fact, it's not the responsibility of association.
No.
It's not the responsibility of Ministry of Health or Ghana Health Service. It's the responsibility of everybody. It's wherever you are, you make sure that your collective effort is actually pushing the agenda. And that basically is the beauty of what we are starting now. Right. And so with this broad overview, what will be happening in subsequent months is that we will be taking some of the blocks individually, not necessarily in relation to COVID, but if you talk of let's say community resilience, I mean, a whole aspect of that will then be dissected by people who can speak to that area. If you talk of health information systems, I mean, what does it mean? How do we maintain it in a resilient way? I mean, so that we can go to town on that. And we are hoping that as we move into those areas, I mean, we'll be able to make informed the decision on that. But we definitely welcome your contribution, your support, and your participation. And I can see some of the senior people, especially Kenneth, is always around to give insightful comments. I've seen Maria Hagan, Wilhelmina. I can identify you. Our dear old in Siri himself, I think I can recognize him. Quite a number of the students and residents of the public health faculty of the Ghana College and also School of Public Health, I can identify a few of you. Then Francis, we've already acknowledged, and like I said, quite a few. A few of us we can't recognize you because the names are not appearing quite well. But whether you are publicly acknowledged or not, you are certainly welcome. And we hope that in a month's time, there will be another session looking at an aspect of the health systems to go a little more the detail into that particular block. And then when we invite you, we hope that you will be available to participate. Thank you so much. James, over to you.
Thank you, Dr. Mufa, and thank you so much, Dr. Eugene Nyarko, for the presentation.
Thank you.
All of us, this recording will be made available on our YouTube channel or be sent to our WhatsApp platform. And going forward, there's a lot of things that the executives are doing that will be sharing with all our members. So let's still check on our WhatsApp. This have been made payment of our dues. Let's make sure we do the payment. and then look forward to the exciting things I'll be sharing with all our members. Thank you so much for joining all of us. Thank you so much and have a good evening. Thank you.
Good evening.
Thank you. Thank you. Bye bye. And we are developing. We are developing a website. When it's ready with the various social media, there will be an official launch of all of them together as part of our contribution to access of information and some of those things. And some of these brilliant talks will definitely be featured in that. Though it goes beyond Ghana and even to the international scene for people who could not join to also benefit from the excellent presentations. So thank you very much.
Thank you.
Thank you.
All right.
Thank you.